Mr. Frank. Ms. Megyery.
Madame la Présidente, honorable sénateur.
Madam Chairperson, Honourable Senators, on behalf of the Chamber of Commerce of Canada, thank you for this invitation to discuss Bill C-64. Why is this bill important for the Chamber and its 220,000 members, companies from all sectors of all sizes across Canada? It is common for employers to provide their employees with a benefits program. Although these employer-sponsored benefit plans are not mandatory, approximately 90% of medium to large-sized employers and approximately 70% of small businesses offer a benefits package to attract and retain employees. Over 80% of employees say that health insurance is extremely important to their decision to stay or change jobs. There are significant investment in the health and productivity of employees. Absenteeism or poor performance due to health problems is a major concern for employers and has a negative impact on business competitiveness.
Allow us to share some comments and concerns. First, the Chamber firmly believes that all Canadians should have equitable access to prescription drug coverage. To best understand what is required to achieve this, let us begin by scoping the problem. The Conference Board of Canada found that 97% of the population is eligible for prescription drug coverage. The number of people not eligible for a public plan and not enrolled in a private plan is under 1 million people. Further, 3.8 million Canadians are eligible but not enrolled in a private or public plan as a result of lack of awareness of the programs or unaffordable out-of-pocket costs. That's the problem we need to solve for. How to ensure that Canadians who are not insured or not properly insured have access to the medications they need with a pragmatic and fiscally responsible solution. A universal single-payer system is neither. Let's look at the cost. For the first phase to cover contraceptives and diabetes medications and devices, the PBO set the cost at $5.7 billion over 5 years. The PBO assumes that workplace benefit plan coverage would not be impacted by Bill C-64. While that is not what the bill states, if that were the case, the cost of Bill C-64 would be offset dramatically, but still rising to almost $1.9 billion over 5 years. This brings us to the issue of pragmatism. There's no need to completely undo a system that provides a majority of Canadians with the coverage they need and appreciate. A single-payer universal Pharmacare would actually leave most Canadians worse off. Currently, the majority of Canadians are covered through their employers. These Canadians have access to medicines in half the time as those on public plans and to 3 times more new innovative drugs approved by Health Canada. In 2023, Ottawa announced the Canadian Dental Care Plan, stating the plan is not intended to replace existing dental benefits offered through employer-sponsored programs, but rather to fill existing gaps in coverage. The Minister of Mark Holland has stated that the federal Pharmacare program would not jeopardize Canadians' private coverage, but the bill repeatedly references a national universal single-payer system. This bill should be amended to ensure Pharmacare targets those Canadians who do not have the coverage they require, just as the government did with the Canadian Dental Care Plan. Such a targeted model would be more pragmatic, financially sustainable, and better respect provincial and territorial jurisdiction.